Okay, let's talk about kidney stones. If you've ever had one or know someone who has, you know just how confusing all the treatment talk can get. So today we're going to cut through all that noise and give you a really simple guide to what actually happens. So, you get the news. You have a kidney stone. And right away, a million questions pop into your head, right? What happens now? What am I supposed to do? It's totally normal to feel a bit lost. Well, here's the good news. It turns out that pretty much the entire game plan, everything from what you do at home to what might happen at a hospital, it all boils down to one simple thing: the size of the stone. Why? Well, because its size is what determines if it can actually make the journey out of your body. Think of it like this. That single measurement is the key to everything that comes next. All right, so let's start with the most common situation, which is dealing with small stones. For these little guys, doctors usually take what's called a wait-and-see approach, which really just means helping your body do what it does best. We're talking about stones that are less than 5 millimeters here. And to give you some perspective, that's smaller than a single grain of rice. So for stones this tiny, the goal is pretty straightforward: manage the situation and help it pass naturally. And a game plan for that is usually a 3-step process. First up, hydration, and lots of it. The more water you drink, the more you flush your system, which can help push the stone out. Second, your doctor might give you a medication called tamsulosin. What this does is it actually relaxes the ureter, the tube the stone has to pass through, making that journey a whole lot easier. And third, pain control. And this is a big one, because let's be honest, this process can really, really hurt. Okay, now for the next category. This is what you might call the in-between zone. It's kind of a critical crossroad where the path forward isn't quite as clear-cut. Now we're looking at stones that are between 5 and 9 millimeters. So they're not tiny anymore, but they're not huge either. This is that gray area where just waiting and seeing might not be enough to get the job done. And this brings us to the big question for stones this size, and it's a simple one. Do we need to step in and do something or not? See, the answer isn't always a definite yes or no. This is what we call the observation phase. This is where you and your doctor really become a team, keeping a close eye on everything. The decision to intervene is going to depend on things like how much pain you're in, whether the stone is actually making any progress, and if there are any signs of a blockage. All right, let's move into the big leagues. We're now in territory where just watching and waiting is no longer the main strategy. When you're dealing with large stones, it's pretty much a given that it's time to take action. We're talking about any stone that's bigger than 9 millimeters. Once a stone gets this big, the chances of it passing on its own are, well, very, very low. It's just too big for the plumbing. And the risk of it causing a major blockage gets a lot higher. So this is where procedures come in. There are a few main options. One is shockwave lithotripsy, which uses focused sound waves from outside your body to blast the stone into smaller pieces that you can then pass. Another is ureteroscopy. That's where a doctor guides a tiny, tiny scope up into your urinary tract to either pull the stone out or break it up with a laser. And sometimes they'll place a stent, which is just a small tube, to prop the ureter open and make sure everything keeps flowing. Okay, let's pause for a second and talk about something really critical. We've gone through how treatment is based on size, but you absolutely have to know when a kidney stone becomes a real medical emergency. Recognizing these signs is incredibly important. So what you're about to see are major red flags. If any of these things are happening, this is not a wait-and-see situation. This is a get medical help immediately situation. Let's break this down because it's that important. First, if a stone is causing a blockage and you have an infection, that's an emergency. The risk of sepsis is incredibly high, and sepsis is your body having a massive, life-threatening overreaction to that infection. It's an all-hands-on-deck medical situation. And finally, if you only have one kidney, any blockage is a critical emergency because that's your body's only filter. So, as you can see, there's actually a clear logic to all of this. It's not random. From just drinking more water to watching and waiting, all the way to a full-on medical procedure, the plan is almost always built around that one simple fact: the size of the stone. Really, the key is just knowing when it's okay to wait and when it's time to act. Understanding the why behind it all can make a huge difference. So I'll leave you with this question. Armed with this knowledge, how much more prepared do you feel now to have that important, informed conversation with your doctor?